It's Valley Focus, and I'm Kayla Mortellaro, your guide for the program as we continue our coverage of coronavirus and COVID-19, trying to have everyone as prepared and understanding as possible here as we are joined by Dr. Langland, professor and biologist at Southwest College of Naturopathic Medicine as well as ASU. Dr. Langland, thanks so much for taking some time with us today.
No problem. Glad to help.
All right. So first and foremost, we kind of have an understanding of now what the coronavirus is and COVID-19, but how does it actually enter the body?
So, yes. So as everybody knows or should be aware of, obviously the concern here is respiratory spread. So the virus is, spread from person to person, commonly like we see influenza, where the virus primarily enters the respiratory system, transferred between people more or less by sneezing or coughing and then inhaling those droplets, as well as contact with surfaces that if people sneeze into their hand and then they touch a doorknob or touch a faucet and then someone comes along after that and touches that doorknob, they're going to pick up the virus on their hand, and then if they rub their face or nose, the virus can enter them that way as well. So, all the guidelines of that 6 feet of distance is to really keep that social spreading around there is trying to keep people from coming in contact with sneezing and coughing. But then you have to also be conscientious of your environment of if you're touching a doorknob, touching a faucet, you're not rubbing your face with your hand and getting the virus into your system that way.
So about how long does the virus stay on those surfaces? And, it could probably be staying on the surfaces, but about how long is it still, active or at its strongest peak, if you will?
Right. And that's somewhat controversial at this point in time. But most estimates are, if it's a nice solid surface like metal or plastic, it's probably on that surface for at least 24 hours. There's some estimates saying it can even survive up to 3 days on a surface like that. A more absorbent surface tends to be less stable and may only last a few hours. And also depends on where that surface is. So if it's outside and getting exposed to sunlight and drying, it's probably going to last only a few hours. If it's inside where there's more moisture, like in a bathroom, or colder temperatures, like in a house, it's probably going to be more like 24 hours that's going to last there.
So there's also been some chatter here, at least, that Arizona isn't going to see as big of a spread because of our warmth. Tell me that I'm right or debunk that.
And I'd love to give you a perfect answer to that, but unfortunately, since this is a new virus, we don't know for sure. We can model it off of other respiratory viruses like this, like the common cold and like influenza, where those are seasonal viruses that once we start getting into warmer temperatures, we start to see those infections diminish. And a lot of that's due to the nature of the droplets that as we start to warm up our temperatures, the droplets that the virus has spread through sneezing and this sort of thing dry up much faster, so the virus is less stable. The temperatures warm up surfaces, and so the virus structure tends to need some moisture within it, so it tends to dry up and kill the virus much more quickly. So predictions are that once we do start to warm up our temperatures, hopefully we will start to see a diminishing of the infections as well right there. And I hope that's going to be true, but still we're dealing with probably not seeing the temperatures really get up to where we want to see them until probably mid-April to end of April until we start to see that hopefully a drop in the infections there.
We're chatting here with Dr. Langland, professor at Southwest College as well as ASU, as we are trying to get as much information in the hands of you in terms of the coronavirus and COVID-19 and everything like that. So there's kind of been an array of topics in terms of what are the symptoms and what you should be looking out for, and it's kind of evolved and adapted in the last month or so. So what's kind of the latest and newest thing that we should be on the lookout for?
So again, from what we've seen in China, what we've seen here in the United States, most people are going to get either asymptomatic or have mild symptoms. A lot of those being somewhat flu-like, difficulty breathing, Typically, a slight fever with that, typically around 100, 101. The shortness of breath is probably the most common thing here with a dry, productive cough. The virus really gets down into the lungs, gets into those cells there, replicates and gets into the mucus then, and that's what you're spreading from person to person, is that virus being released into the mucus surfaces there. So, but the main things the complication with this is really getting that respiratory tract and leading to constriction of your bronchioles, and that leading to difficulty in breathing and those sorts of aspects.
So, I mean, this is also new, and there's not really been a whole lot allowed to be able to digest this virus and things of that nature, as you've kind of mentioned here. But are there any indications as to why COVID-19 seems to be more powerful than other respiratory illnesses?
Well, it's just a different virus. I mean, this, so this belongs to the family of coronaviruses. So in the past, in 2003, we had an outbreak in Asia alone of the SARS virus. That was a coronavirus as well, really similar to this coronavirus. But luckily that one had a shorter incubation period, which is a time when you get infected to start to show symptoms. Most people with that disease and that virus showed symptoms in about 2 or 3 days. So that one was easier to contain. And so, that was really isolated just to China. Another virus in the family is MERS, which is more a Middle Eastern version of this virus. And again, that one got contained pretty well. The problem with this newest virus here is really that incubation period, where from the time when people get exposed to the virus to when they start to show symptoms is on average right on 14 days for a lot of people. And so people will come in contact with the virus and not show symptoms for 2 weeks. And it's estimated that during the end of that incubation period, they may actually be contagious. And so that's been one of the hardest aspects of controlling this virus, is that long incubation period, because it's hard to keep people quarantined. Who do you come in contact with over, if you start to show symptoms and you got exposed 2 weeks later, who all did you come in contact with over that time span? And it's really hard to contain a virus like that. So it's, unfortunately, this is part of biology, where humans are just a biological entity. And, this is a virus that is zoonotic, which means it likely came from a bat. The bat was the original source for this one here. We've now sequenced the virus, and it seems to have similarity to a bat coronavirus as well. Either got right from the bat right into the human population, or went from a bat to another mammal and then into humans. But, this is what we come in contact with, and it's part of, just like I said, part of biology, where as humans get exposed to other animals that carry viruses that are common to that animal species, sometimes they'll get into humans and cause a new disease. Other times they'll just die off. And this one, unfortunately, was a new one that got into humans and led to this current pandemic.
We're chatting here with Dr. Langland, professor and biologist. You know what? You just tell me that.
I'm a virologist. Yeah.
Perfect. Thank you. At Southwest College of Naturopathic Medicine, as well as at ASU. So a lot of information has been coming out in terms of the NBA, and they're kind of the ones that started this whole, okay, we're shutting everything down. But a lot of players are testing positive for it. And in that group of players that are on the same team, they're saying only one is experiencing symptoms. The rest are asymptomatic. So is it that they're asymptomatic at that time of the test, or is that they just, for whatever reason, haven't been as impacted by the virus?
Probably a little bit of both. That they were lucky and they didn't come in contact with it. We got that. Were they around when someone that had the virus was coughing or sneezing, and they come in contact with it and they just haven't come down with symptoms yet? Or were they lucky enough not to inhale any of that? And again, this comes back to the common flu as well. We have flu come through the population, and some people get sick, some people don't. And, you can have the flu in your family, and one or two people may get sick, the other ones may not. Similar situations are happening here, where It's going through the NBA in some of these teams, but some people will show symptoms. Some people will be asymptomatic. Some might be delayed. And so it's a mixture of everything there.
And what should you do if you do fall ill and are worried that you do have COVID-19?
Well, certainly you want to stay isolated. We're ramping up as far as testing being available. So, if you feel you have that shortness of breath and a dry cough and a fever associated with it, you really should go down and see either urgent care or your primary care physician to test and see if you have COVID-19. But either way, you really should stay indoors, because if you start to feel sick and maybe have, just a common cold or some other infection, that makes you more susceptible to being infected by COVID-19 as well, and possibly having more severe conditions. So either way, the idea of, really having the social distancing is true here. And if you come down with any sort of symptoms at all, for society, for the sake of society, and, especially the people that are more at risk, you really want to stay at home.
Dr. Langland here, providing a lot of great information on COVID-19. There's been a lot of discussion as of recent in the news about different medications that have been used for other diseases, and there hasn't been a whole lot of testing in terms of how they would help a COVID-19 patient. Is there any more information on any of that?
Unfortunately, not really. I mean, this is a virus family that we don't have a lot of drugs for. And so, we have medications potentially for the flu, but most of those would not work for this virus based on how they work. So there's a lot of trials going on right now. There's vaccine work going on right now. But it's a lot of just testing and trials based on what we know about this virus and what may be potentially a useful treatment. But it's still completely in its infancy stages, really. And
that was going to lead to my next question here. What can we expect about the process of finding a vaccine? This is not an impossible virus to make a vaccine to. It's, one aspect is the virus does tend to mutate quite rapidly. But there's vaccine work going on right now to look at areas of the virus that are stable that we could potentially make vaccines to. At ASU, that is currently being taken underway, along with other groups across the United States, trying to develop a vaccine. We are in initial clinical trial or initial small trials with potential vaccines. The problem comes down to, once we develop potential vaccines, to go through all the efficacy associated with it, the safety trials associated with it, and then if it does work, getting out to the public, it probably will be at least a year, if not, a year and a half before it could really get out to the public. And so we obviously know about the conversation surrounding flattening the curve, but I guess my question here is, so at some point COVID-19 will kind of come down in terms of that curve, but then will it come back around with us? And is that the hope that the vaccine would be available by the time it comes back around?
Yeah, and that's really what it is. Because here again, we don't know a lot about this virus. We don't know, we look at SARS. That's the other virus that was here before. So SARS was a coronavirus that came out in 2003 as a outbreak in China. And really, once that virus came out in 2003, it really disappeared after that. We didn't see any more of it. MERS was kind of in between, where we still see cases of that from year to year. This one now being spread worldwide. A lot of people predict that this may be a virus that is going to be back next year once the weather cools down and gets more moist again. And so preparing for the future, once we do make it through this current pandemic and outbreak that's going on right now, that if the virus does come back, our next winter season, we'd be prepared for it and have vaccines available.
And a lot of people just are stressed and very anxious about all of this that's happening. So do you have anything to kind of say to those people?
Yeah, and I think everybody's stressed in one way or the other. It's certainly, this virus is disruptive to, I'd almost say, everybody across the entire United States as well as worldwide, with social distancing, how to stay at home, job problems, everything like this. So it's hard not to get stressed about it, but at the same time, People need to realize that as you are stressed, there's definitely known effects of when you get stressed, your immune system becomes weakened. So people need to try to calm down, not panic about this virus, but again, take it seriously and stay indoors as much as you can, and try to stay healthy. Eat well, have good nutrition, try to stay up on your health in terms of exercising. We're recommending social distancing, but if you can go outside and be in your backyard and get some sunlight so you're not just stressed and claustrophobic inside your own home, anything like that you can do to make your life more relaxing and less stressed and come to grips with this, that we will make it through this. We need to work as a society, work together, and hopefully in a month to 2 months, this will subside and we will recover as a society.
Dr. Langland, I greatly appreciate you taking some time with us today here and trying to educate our listeners on everything that's going on with COVID-19. And I'm going to let you end by saying what it is that you do and where it is that you're working.
Yeah. So I'm full-time faculty at Southwest College for Naturopathic Medicine and then joint faculty at Arizona State University. And I've been doing research on viruses for the last 30 years or so. And currently what we're working on is actually my projects involve the use of characterizing botanicals and the usefulness of botanicals and herbs and how they can be used to boost your immune system or fight off viral infections. And so related to that, we're actually starting a project right now where we're working with a lot of herbs that have been used in China to fight off previous coronavirus infections. And we're hopefully in the next few weeks to a month, starting to test some of those herbs against COVID-19 to see if we can potentially develop therapeutics based on botanical medicine to treat patients for this virus as well.
Well, thank you so much for all that you do. Thank you so much for taking a small part out of your day to help us kind of, as you say, calm down, relax, and not let those stressors get the best of us as we all work on social distancing and all do what's best for humanity here.
Great.
Thank you so much. That's Dr. Langland, and you've been listening right here to Valley Focus.